The last 5 years, we've seen an average of 42 suicides a year in Winnebago County, a disturbing number our community is working day and night to change.
But new data from our county coroner, Jennifer Moraski, shows 2024 is off to a start that would double our yearly average. Our high water mark over the last 5 years was back in 2019 when 50 people died by suicide. The next year was our lowest over that time frame with 38 people who took their own life. That number is much closer to the average we told you about, but we are off to a disturbing start in 2024 with 7 deaths by suicide, which puts us on pace to double our average suicide numbers. Which is why all week long we're digging deeper into mental health, what our area does well, and what we need to fix as a community, state, and country.
And tonight we show you the stories behind those statistics we just showed you a little bit ago. They're stories of loss and pain, but also of hope.
In 2018, I lost my 14-year-old son to suicide.
And I walked in and found my worst nightmare come true, and he had taken his life.
It looks like many, many nights of tears and just a constant fear that you'll wake up and that person will not be there the next day.
These are just 3 of the people in our community who know firsthand how big of an issue suicide and mental health are in our community.
But losing my child broke me. You know, it's as if like part of me died with him.
Laura Kane lives her life encouraging people to keep going. When she lost her son Zachary, helping his classmates through depression and other mental health struggles ignited a passion.
And that's how purpose, like just being able to help those kids, it was like they were bringing me healing and understanding of what my child may have been struggling with.
Now she runs Marshmallows Hope, a nonprofit that connects people to mental health services. Britt Cotton says without them, she would have lost a second child to suicide.
And they care. It's people that this is their passion project. They're not there for the money. They're not there for any of these things. Honestly, I feel like if they didn't exist, my daughter would not still be here.
Javier Whitford also found a passion as an advocate for mental health. She started the Tommy Corral Foundation, named after her son, to educate, connect people to services, and make sure no one suffers the same loss she did.
Is finding a way to take this pain and turn it into a purpose to help other people. And also, honestly, I do it every day to keep his memory alive, to honor him and the person he was.
Whitford and Kane are just 2 of the dedicated people in our community, fighting day and night to help people struggling with their mental health or are suffering from a mental illness. But our community faces a bigger need than we have ever seen before.
Young adults between ages 18 to 34 in 2023 reported about 50% of those people reported having some type of mental illness.
Over the next week, we'll tackle the issues surrounding mental health, where we succeed and fail with treating mental health, and where we can find hope that the state line will one day be a home everyone can heal in. There are a lot of encouraging things happening in our community, but also a lot of issues for us to cover on the rest of our State of Mental Health special. Tomorrow, we tackle our services here in the state line, what we do well and what we do not have in the 815 for mental health care.
And that's closely related to our topic on Wednesday, insurance, and specifically the extra hoops that people with Medicaid have to jump through, which can mean life and death for people in a mental health crisis.
Then we broaden our focus to rural areas. What services do they lack, and how does it impact places like Rockford when they have to share their already sparse resources?
And finally, we'll wrap up with education, a call to action we can all meet, and the laws being crafted right now to make sure our children know how to navigate their mental health.